Good afternoon, friends. It's a great privilege to be here today, especially on the National Youth Day. Honorable Pro Vice Chancellor Sir, Dr. Pradeep, Upasna ji, and all of you. You just had a pledge that you will never take drugs, isn't it? So, if you strongly want to follow this means when we say drugs, it means all kind of drugs. It does not only mean cocaine, heroin, sharab, warab, gutka. It also means drugs for diabetes, drugs for BP, drugs for fever, drugs for headache. Those are also drugs. So when you say drugs, I will never take drug, it means no drugs. And if you are not taking any drugs, if you say that I will never take drugs, that means you will never go to the hospital also. The important question is, if you fall ill and you don't want to take drugs, then what is the solution? So we'll talk about this today. And I'm running 55 hospitals, 500 clinics, and what I'm going to tell you now, after that, I hope that you will never need any hospital, not even my hospital. The fastest, safest medicine and long lasting. There are two words. One word is called drug, which we just had a pledge. One word is called medicine. So what is the difference between drug and medicine? You have to understand that. When you say drug, it means a chemical. When you say drug, it means a chemical. It has to be a chemical, right? To be injected into the body. Either you will eat it, drink it, or inject through the blood vessels. So that is a drug. Now the medicine. What we mean by medicine? Medicine is, if you see from the dictionary, medicine is not a tablet. When we think of medicine, we think of a tablet or a capsule. But in real sense, what is medicine? If you see the dictionary, the word medicine means any science which can help you to prevent or control or cure a disease is called medicine. This means anything can be a medicine, but the condition is it has to be scientific. It has to have some proof, some evidence, right? And it should be having the ability to prevent a disease. And if the disease happened already, it should have the ability to cure a disease. Then it is a medicine, right? So medicine may not be drug, first of all. So you just had a pledge, I will never take drug, okay? Don't take drug, then take medicine. So now I'll introduce the first and the most important. आप आगे करोगे? First slide. मैं next बोलता जाऊँगा. The most powerful medicine on earth is right there, time as medicine. Works very, very fast. For most of the disease, it will work very, very fast. Time as medicine, the scientific. It is called the circadian clock of the body. I'll just take 1 or 2 minutes to explain, and to explain I'll take a small model so that in limited time, not only you understand, you are able to remember it. Now you see, you can see some gears. Normally these gears are hidden. Only you can see the second and the minute and the hour hand. But at the back there are some gears. But here I just modified this watch, this clock, to put all the gear in front. So you can see the movement of the gear, right? So now my question to you, if I disrupt or interfere with any one of the gear, will it affect the other gears movement? Yes, because all are connected with each other. Even if it's the smallest one I disturb, even then it will reflect on the largest one or each one of them, isn't it? Because they all are connected to each other, right? One can move at the right speed only when the other are moving at the right speed. If one gets disturbed, the other will get disturbed because they are interconnected, right? So our body is like that. All the organs, the brain, the heart, the kidney, the lung, connected with each other. You disturb one, the rest will get disturbed. Other way around, you cure one, the rest will get cured, right? For example, let's say this is a stage, there is an orchestra team, tabla, guitar, bansuri, right? And they all are playing the music. And suddenly, someone just disturbed one of the musician. So once only one musician get distracted, that will lead to the distraction of rest of the musicians. But they are still playing their instrument. But now what you will hear will not be called as a music, that will be called as a noise. So what is the difference between noise and music? When it is a music, there is a harmony between all the musicians, then it is a music. When the harmony is lost, then the same, it becomes a noise. When the harmony between the organs of the body is lost, then the life becomes a noise. That is called disease. Without understanding this, you can never, ever cure a disease. Drugs cannot cure a disease, but the harmony between the organ can be cured, can help cure a disease. And to correct the harmony of the organ, you just need the most important medicine, that is called the time as medicine. This is very simple, and I want you to try at home for at least 1 week, or ideally 10 days, right? If in your family there is a diabetes patient, or patient with constipation, or BP patient, or patient with sleeplessness, with depression, or with joint pain, try this, right? Time as medicine. It is very, very simple. Don't eat anything before 8 a.m. and don't eat anything after 6 p.m. Stop eating after sunset. Just what I said in last 10 seconds. Just do this. I am not asking you to eat a special food. I am not asking you to eat less. I am just saying, with sunset, stop eating. Right? This means 8 a.m. to 6 p.m. You can have little bit cheating, let it be 7 p.m. Little bit relaxation, but not beyond that. So what will happen if you do it? Let's say you go home and you make a strict rule that for next 10 days, the kitchen will be locked after 6 p.m. What transformation you can expect? We do it every day for last several years in our hospitals. And when we do it, what we have seen, what you will see. Next slide. Within a week to 10 days, the constipation starts reducing. The acidity starts reducing. The bloating starts reducing. The sleep starts improving. And if you do it beyond 7 days, by the second week, the joint pain, arthritis, right, it will start reducing. And if you go beyond third week, the BP sugar will start stabilizing. You need to drop that sugar medicine, the BP medicine, as Madam Upasana was telling. And if you go beyond 4 weeks, your gastric esophageal reflux disease, which gives you the pain of a heart attack, or your weight for those who are very, very fat, that will reduce on average by 5% per month till you achieve your normal BMI. Just one change, that is called time as medicine. And on the contrary, do whatever you want in the world, but don't change this. Try to eat the late night, say at 10 p.m., 11 p.m. No good food can help you heal. For example, if you have an enemy and if you really want that he should die very fast, right? So what you have to do? Every night you ensure that at 11 p.m. you supply him some food, right? He'll be happy that you are giving him food, you are taking care of him. But what will happen? You have to understand that disturbs the circadian clock of the body. You can try it. You take a banana and try to give it at 10 p.m. to a monkey. He will throw it back to you, right? So all the animals, they are having their own circadian timing. For example, in the middle of the night, sometimes we get up and we go to the kitchen just to drink water because we are feeling thirsty. At that time, many times, you hear some unusual noise. That is the noise of the rats. Rats are active at night, not in the day. Their circadian clock is after sunset. After sunset only they will eat. They will find food and they will eat, not during the day. So during the day they take rest, during the night they eat. All the animal and the birds, they have their time of eating, and they never disturb that. Humans, especially in last few years, after Zomato, Swiggy, Netflix, right? So we are having more access to the food, we are having more access to the entertainment, and that way, uh, anytime we can order a food, anytime we can watch a movie. In our times, right now I'm 50, when I was your age, Doordarshan at 9 p.m. it is closed. Now no source of entertainment, right? We have to sleep. So we have to understand this. This is called time as medicine. If you know anybody having these sickness, and just ask them to follow, and you will see the result. That what will happen when you do this? The circadian clock of the body will start recovering. This means the compatibility between the organs, right? The communication between heart and the brain, the communication between brain and the stomach, the communication between stomach and the kidney, those communication will build up, and once those communication builds up, then you will see a very, very fast healing, and within days you will see these changes. Just make one change. Time as medicine. Just now, before I came here with Pro Vice Chancellor Sir, we were interacting, and Dr. Rekha sitting here, and they were discussing that why the youth are so attracted towards drugs, allopathy medicines. They believe, then Pro Vice Chancellor Sir said that maybe allopathy is very, very fast. It works immediately, right? Everybody wants shortcut. If you have a headache, you take a pill, within 15 days, minutes, the headache is gone. You really want shortcut? I can give you something faster than this, right? So if any of you who don't want to wait for days to get healed, you want to 1 month to get healed from these, if you want to heal very, very fast, then you have to add the second medicine. That is called food as medicine, the next medicine. Add food as medicine, and the speed, instead of number of weeks, 4 weeks, it will convert into days. Next slide. So when I say food as medicine, this means now along with time as medicine, you have to change your food also, because you want a faster result. You cannot wait for days. You want a solution within a few hours, 2-3 days, less than 1 week. What you have to do here, you have to follow what we call as DIP diet. DIP diet I invented about 15 years back. That time I wrote the book Last Days of Diabetes, right? And you can, whatever book I'm showing, you can get it free download from this link, bishrup.com/ebook, for detailed understanding of what I'm saying. Next. This DIP diet is having clinical trial are done by Government of India. Next. Government of Nepal. Next. अगला वापस करो. This is Malaysia, right? So, and it is seen if the person changes the diet and adopt the DIP diet, it takes few days. Within 2-3 days also, 3-4 days, 5 days, 7 days, and number of changes happens, right? So the insulin, the need for insulin also is decreased or eliminated altogether, or within a month's time, many people, they are able to achieve their normal BMI, or the kidney starts functioning better, as in this trial of Malaysia. So let's talk of DIP diet. If you want a faster result, you, with time as medicine, add food as medicine. I'm just saying that do it for next 3 to 4 days. Next 3 days, 4 days, you take it as a challenge. Let me see what result it gives in just 3 days, right? So first, what is this diet? Let's try to understand that. Next. This diet is very simple. Step 1, till 12 noon. Till 12 noon, whatever goes inside your mouth, let it be only fruits. 3 to 4 kind of fruits of your choice. It can be anything. It can be apple, it can be pomegranate, it can be banana, right? All kind of, it can be oranges. In the season of mango, it can be a lot of mango, especially for the diabetes patients. Diabetes patient, if they are eating sweet fruits, they are able to cure very, very fast. How fast? Maybe within 2-3 days of doing this. So here the important thing, whatever goes in your stomach, in your mouth till 12 noon should be only fruits. I am not asking you to eat less. I am only asking you to eat only fruits till 12 noon. 3 to 4 kind of fruits according to your body weight. My body weight is 70 kg into 10. That becomes, for me, it is 700 grams. So approximately, it can be a little bit less or more according to your appetite, but it can be near this. Step 1. Step 2. Next. Step 2. For lunch and dinner, always sit with 2 plates, plate 1 and plate 2. This is the plate 2. In plate 2, whatever you have been eating till now, you can continue eating that vegetarian food. Roti, sabji, dal, chawal, right? Pasta, ulta, seedha, whatever. Jo bhi khana hai, ulta se khate aaye, wohi khana. This means I am not restricting your eating. I am adding one more plate. Plate 1. What is plate 1? 3 to 4 kind of vegetables of your choice which you think that you can eat in raw. Tomato, cucumber, radish, carrot, onion, etc. And according to your body weight, right? My body weight is 70 kg into 5, that becomes 350 grams. This means before I start eating the cooked food, I must finish eating 350 grams of raw vegetable, that is called salad. If not 350 grams, at least 300 grams. Salad we all eat, but it becomes a medicine when you eat in this formula, this quantity, and when you eat before eating the lunch. And also do the same in the dinner also. Before the dinner, add this plate, right? So that is the step 2 and the step 3. Step 3 is very simple. Avoid taking all kind of food which comes from the factory. No packed food, no refined food, no fast food. Initially I am asking you to do it only for 3 days. And if you see clear-cut result, then it's your choice. Avoid taking all kind of dairy product and animal food. No animal food, no dairy products, right? And something which is optional for you, all kind of dry fruits are allowed, all kind of nuts are allowed, all kind of sprouts are allowed. Fruits can be taken even after 12 noon as a snacks, but not after 6 or 7 p.m. as I told. Have little bit of sunlight every day. If not 40 minutes, maybe at least 15 minutes. If you can do it, then what you can expect tomorrow? Next. Within the 24 hours to 72 hours, for most of the diabetes patient, their blood sugar will steeply drop and they will be forced to stop the medicine. If they don't do it, they will become hypoglycemic. For insulin dependent patient, within the first 3 days, they are expected to taper down the insulin at least by 50%. If they don't do it, their blood sugar will go too low. That can be dangerous. And by 3rd day, for most of my patients, the blood pressure becomes normal and they need to drop the blood pressure medicine. 3rd day to 1 week, the cholesterol becomes normal. Intestinal disorder like constipation or gas or acidity or bloating, these things vanishes. But if you can do it for longer, let's say for 1 month, in 1 month, about 10 to 15% weight loss, first month. Only you do time as medicine, 5% weight loss. If you add this food as medicine, now 10 to 15% weight loss. Healthy weight loss. Healthy weight loss means, when I say weight loss, it means the weight of the bones, weight of the muscles. What weight loss you want? Do you want that? No. We want to lose weight, our excess weight, unnecessary weight, the fluid deposit. So that should be the healthy weight loss, right? Heart disease. If there is angina pain, the typical heart disease, it takes about 1 month to get rid of it. Otherwise, doctor will say angioplasty or bypass surgery. If you can do it for 2 months, within 2 months, for most of my patients, their thyroid medicine are eliminated altogether. The TSH, the thyroid becomes normal. Within 6 months, the symptoms of cancer, it vanishes. Right? Within 8 months, the kidney dysfunction, otherwise the patient was in dialysis, right? They are able to recover. And for example, many of you I can see wearing glasses, right? If you can do it for 3 months, most likely you will not need the glasses, right? So So this is the timeline when you add the diet with the time as medicine. But if you are looking for something faster than this, if you want to solve many of your problems within few minutes, then you have to add the third medicine. And the third medicine is, next slide, 0 volt as medicine. Some engineering student here? Engineering student, how many? Many of you. You will understand this better, right? Okay, thank you. 0 volt as medicine. So this can be an homework also. Homework means your classroom work, an experiment. You know voltmeter, multimeter, you are an engineer. So you take the multimeter, normally through the voltmeter, multimeter we check the voltage etc. of the electrical equipment. Human body is also an electrical equipment, you have to understand that, right? Doctors through stethoscope checks your heartbeat, right? That is the electrical signaling, right? When the doctor says go for ECG, electrocardiogram, electrical signaling, right? You have to understand when somebody suffers from heart attack, that is a mechanical failure. When somebody suffers from cardiac arrest, it is electrical failure. Heart attack is not dangerous. Person are saved on their own. Most people don't die. Cardiac arrest, immediately people will die. Cardiac arrest is electrical failure. You have to understand that our body is also an electrical equipment in a way as your computer, as your AC, everything. So your body also carries a voltage. And that voltage is very much measurable with the normal voltmeter which you are having in electrician normally keeps with them. So step 1, you can check what is the voltage of your body. You'll find some 0.2, 3, 4, some volt each one of us. Now the most important thing, our body functions the best at 0 volt, shunya. When our voltage is 0, our immunity is at the peak. And that is the time when body starts healing very, very fast. If you can make your voltage 0, the body starts healing very fast, right? Now the question is how to make the voltage 0. You can try this today or maybe tomorrow, whenever your Pro Vice Chancellor sir give you permission, then you can try it. What you have to do? Go out in the open field, open ground, and take off your shoes and step on the grass or on the earth directly. Now when you check your voltage of the body, within the first 10 seconds, you will see your voltage will drop to 0, right? But what will happen after 10 seconds? That is very, very interesting, right? Next slide. If you be on the earth directly for about 20 minutes, the stress will go and the mood will refresh, anxiety will reduce, right? But if you stay on the earth, in touch with the earth, that means your voltage is 0 for about 45 minutes. The heart irregularities, the palpitation, it starts reducing. And if you stay connected, grounded to the earth directly or on the grass, it takes 1 hour to give a pain relief. That means staying grounded for 1 hour is equivalent to a pain killer, the natural pain killer. Very, very important. And if you can do it for 2 hours, so that night you will have a better sleep. In our hospital, the patient who are having external wound, we keep them grounded for overnight. Parkinson patient, we keep them grounded overnight. The whole night they are connected with the ground. You must be thinking that, oh, we put the patient outside the ground to sleep in the night. No. What we do, we had made an arrangement where we connect their body with the ground. So what you have to do, I'll just explain. Let's open it. Engineering student, pay attention. You try it at home. Take it. Now this is an equipment tool. You can try it at home. So this is a simple wire, right? And this is a copper rod. What I'll do, if I dig the copper rod outside where there is a ground, and I extend this wire inside, and now this end of the wire, if I touch bare hand, this means through this conductive wire I am connected to the earth. And now if you check, if I do it at that time also, my voltage will be 0. So when you directly touch the earth, your voltage becomes 0, or when you touch the earth through this conductive rod, this wire, like the earthing, right? It is the same earthing. You do earthing for all the electrical equipment, the third pin, the bigger pin, that is the earthing pin. So similarly, the human body can also be earthed like this. So what we do in our hospital, we place the rod like this, and from the window we pull a wire and we tie this wire with the patient's skin. And that way the patient, while staying in that room, is 0 volt as long as the patient's skin is touching the this end of the wire, right? So but that can be very, very uncomfortable for the patient to remain tied with the wire. So we devised a bed sheet. Here you see, this is an experiment which you have to do, the engineers, right? You see, this looks like a simple cloth, but here you can see some lines. These are all copper wire. Copper wire, so that is the weaving held. At the time of weaving, the copper wire is weaved on the cloth, right, along with other threads. And now all the copper wire, they are connected at one point. पकड़ लो इसको, इधर आ जाओ. And now this bed sheet we place on the bed of the patient, and this wire I stick it here, and this I take it outside the window, and this I dig on the earth directly. When the patient is sleeping on this bed, the skin of the patient is touching this wire. At that time his voltage is 0. And when the voltage is 0, then the immunity is at peak. When the immunity is peak, the inflammation, it reduces, infection, it reduces, and the disease start reducing. You have to understand that in the nature, all animals are always grounded. So here we are in a comfortable room, wearing so many clothes, still feeling cold. But you experiment this, you go out and you step without the shoes, you step on the ground. Initially for 30 minutes it may not be very comfortable, but then even if you are without clothes, you will not feel cold. You see the beggars, right? They don't have clothes, they don't have house, they don't have even sleepers, but they are able to sustain the complete colder month every year. They don't die. They are comparatively healthy. Why? They have one medicine, 0 volt as medicine. Even the birds, they sit on the tree is live. They are getting earthing from that. If you touch a tree and then you check your voltmeter, through voltmeter your voltage will be 0. But the tree has to be grounded, not on the pot, right? Not isolated. When I say grounded, I don't mean this ground, I mean the outside earth, right? So this is a homework. This I encourage my patients to make their own. And once you make it, you get a ready supply of medicine every night, because you're sleeping every night on this bed for rest of your life, right? So when you add these 3 medicine in your life, you will see it takes few days to reverse most of the disease, right? And when the disease are reversed, what will happen? Then, like Upasana madam, you will be forced to stop the medicine, the drugs, right? You all are looking healthy, after all you are young. But whatever teaching I am saying, this is for your family members, for your friend's father, for somebody who need this. But I think that everybody needs it, right? If you don't do it, what will happen, right? The breakdown will happen. If you do it, as I told you, within few days, the need for the spectacle will go, your energy level will increase, your performance in your sports will increase, right? You will see a lot of benefit on its own. Your alertness will increase. And to answer the last final question, that the allopathy medicine are the quick fix. But I say, in the nature there are many things which are much faster than so-called this modern medicine. So, as an example, anybody in this hall having some headache right now? How many? 1, 2, 3? Okay. So now, I have this oil, and now there are 3 people, those who raise the hand and they are saying they are having headache. But the truth we don't know. Maybe they are not having headache, they are just saying they are having headache. Or maybe in reality they are having headache. How to know and how to solve the problem? So with this I am going to end this. This I am presenting to our Vice Chancellor, Pro Vice Chancellor Sir, 2-second oil. Sir, how to use it? Inside there is a small bottle, right? You open the bottle and there is one more cap. You struggle to open it. Now these 3 students, or if anybody would like to join them, if you are having headache, just you have to smell the oil. Only smelling. Within 2 seconds, very fast, headache will vanish. Who would like to try? Okay. One warning. I forgot. If there is a headache, within 2 seconds, headache will vanish. And if there is no headache, still you want to smell, you are smelling, then headache will come. So be careful, right? So, this I have for, sir, come on the stage, sir. Gurjeet Kaur, please come. Upasna ji, aap bhi aaiye. I am giving this to your leaders. You can take it and try it and they will tell me. यहाँ आ जाइए. Sir, ये, and the important thing is, ये कभी खत्म नहीं होगा, क्योंकि सूंघना ही तो है, जिंदगी भर चलेगा, पड़ोसियों को भी दे सकते हैं, राइट? मैडम आपके लिए, हाँ, करके देखिए. अभी तो इनके साथ ही करके देखना एक बार, जो ये भी पता चल जाएगा सच बोल रहे हैं झूठ बोल रहे हैं, हेडेक है कि नहीं. ओके. और फॉर द सर लाइब्रेरी आई हैव द बुक्स, जो मैंने बताया, आप ये बुक्स पढ़िए. यू रीड दिस बुक्स ऑनलाइन ऑल्सो, यू कैन डाउनलोड. एंड माई सिंसियर रिक्वेस्ट टू ऑल ऑफ यू, try at least for next 3-4 days what I said, right? जो भी मैंने बताया 3-4 दिन जरूर try कीजिए, and then if you see result, then keep trying, right? So with this I conclude, and thanks for your patience, and you can take these headache oil. मेरा grandson है, आपके साथ फोटो चाहता हूँ. अच्छा, thank you. क्या नाम है आपका? So